And one of my favorite subjects, one of my favorite things to help people with is peripheral neuropathy. And when the diabetic foot, you can also have a peripheral neuropathy. You can actually have a situation where the nerves are malfunctioning, they're not working like they're supposed to in the feet. So everybody that has diabetes is commonly tested for peripheral neuropathy. And there are a couple different tests that are very valuable in testing for peripheral neuropathy that are commonly done. The most common is the Sims-Weinstein monofilament, which is a light touch. It's a little wire, creates 10 grams of pressure that you touch different toes, different parts of the foot to see if you have pressure sensation. And if this is not good, then it's an indication you have diabetes, but it can be normal. The other common test people sometimes do is the nerve conduction velocity test. And this nerve conduction velocity test or even the EMG are commonly used to diagnose peripheral neuropathy. The problem with those tests is they're testing for a large fiber sensory neuropathy only, not standard peripheral neuropathy. So when you're testing the diabetic foot, you say, okay, do I have peripheral neuropathy? Do I have nerve problems? There are multiple tests you need to do. When it comes to sensation, you want to test pressure sensation with the Sims-Weinstein monofilament. You want to test temperature sensation. You want to touch sharp, dull sensation. You want to test position sensation, if the toe's up or down, those kind of things. You want to test vibration. And the idea is every single one of these gives us a good point of reference about how well the nerves are working. Similarly, you can do two-point sensation. All of these should be done. Now, these are primarily for sensory neuropathy, large fiber and small fiber sensory neuropathy. You can do the EMG, or you can do the nerve conduction velocity test, which is testing for large fiber neuropathy. The EMG, of course, is some motor neuropathy as well, would show up in the EMG, but you can do certain types of motor testing, which is strength testing and those kind of things to determine if you have a motor neuropathy. You can do a QSART test or a pseudomotor test to actually determine if you have an autonomic neuropathy, and you can do an epidermal nerve fiber density biopsy to determine if you have a small fiber sensory neuropathy. So the idea, if you have the diabetic foot, if you say, okay, I know I have diabetes, I know I have some of the complications of diabetes, you want to do a wide range of tests. You can actually look at peripheral neuropathy as it really exists. You say, okay, do I have large fiber sensory neuropathy? Do I have small fiber sensory neuropathy? Do I have motor neuropathy? And do I have autonomic neuropathy? You want to test all four. If you don't, you will be missing a piece, and you won't know truly if you have neuropathy or not, because you can have any one of those, or you can have a combination of all four and anywhere in between. So this is Dr. Brandt Gibson, and the nerve testing that you should do for the diabetic foot should be extensive, and all those should be parts of that. This is Dr. Brandt Gibson, and this is Podiatry.